Thank you everybody for coming this morning. Today, Loma Linda University Medical Center would like to make an announcement on the results of a clinical trial for breast cancer study on the use of proton treatment on stage 1 breast cancer. And today we have here Dr. David Bush, who is the Vice Chair of the Department of Radiation Medicine and one of the principal investigators of the clinical study. I also have Dr. Mark Reeves, who is the Director of the Cancer Center here at Loma Linda University Medical Center, as well as Vicky Ramirez, who is actually one of the patients from the first group of the clinical trial study. And what we'll do is we'll just have Dr. Bush, then Dr. Reeves, and then Vicky just share a couple of details about the study and how it affected, specifically to Vicky, how it affected her treatment and how she's faring now after her treatment for proton with her breast cancer. So we'll start out with Dr. David Bush, again, Vice Chair of the Department of Radiation Medicine, one of the principal investigators of the study. Dr. Bush.
First off, I'd just like to say thank you to all of the co-investigators, nurses, research coordinators who have helped make this trial a reality that it is today. It actually began, I believe it was about 7 years ago when we initiated the trial, so there's been a lot of work that has gone into it from then until now, designing the trial, getting the protocol through the regulatory agencies, treating the patients, following the patients, collecting the data, all requires a lot of work to go into actually having results, which is what we have to talk about here today. Just kind of a summary of what we did. We were looking at patients with early stage breast cancer who primarily had tumors that were located just to one area in the breast without having spread anywhere else. All the patients had the primary tumor removed surgically, so the surgeons were a part of the trial for that purpose. Following the surgery, they underwent radiation treatment. The standard type of radiation treatment these patients would get would be what we call whole breast radiation, which is a 6 to 7 week course of treatment. But instead of that treatment, what they received on the trial was what we call partial breast radiation, where we chose only to radiate the area where the tumor originated at. That treatment was given not with X-ray treatment, but with proton beam. And the reason for that is that helps us minimize and in many cases eliminate radiation dose given to the heart and the lung and chest wall, which we believe stood the potential of reducing side effects. So we treated 50 patients that way and followed them now for several years. I believe the first patient we treated is now about 7 years out from treatment. On average, the follow-up has been about 4 to 5 years, and the results at this point have been very good. The recurrence rates are low, and the survival rates have been excellent. But most importantly, what we found is the side effect profile was very good. Things like injury to the heart, to the lung, to the ribs of the chest wall are side effects that we really just have not seen as a result of following these patients. So because of that, we think that the treatment is working very well. What we've done is gone on to begin a second trial, which began just about a month ago. So we're now enrolling more patients onto a secondary trial. The eligibility has been expanded a little bit, but the treatment otherwise remains the same.